Hi, my name is Vivi Stutz. I'm a licensed mental health therapist and I work in my private practice, Phoenix Rises Counseling. And today I want to tell you what to expect in EMDR therapy. So in case you have doubts or hesitations or you're not quite sure what to expect, or if you're a client of mine who was sent this video to, so you know what to expect and how it's going to go. And as an example, I'm going to discuss the standard protocol. There are many variations for the different client needs with EMDR. There are also 3 different ways of practicing EMDR. There's restricted EMD, where we bring down something upsetting, we just reduce the upset and don't do more than that. Where we do targeted EMDR, we really just keep focusing on one event. That's when people have a lot of trauma and they might get overwhelmed. Or we have unrestricted EMDR, where you literally let the brain do its thing, where it's like just associations, whatever comes to mind. So these are the different options. Before I start, I have to warn you or urge you again, please don't attempt to do EMDR on your own. Because I really hope that you're not going to watch a video on appendix surgery and then go into your kitchen, use your kitchen knife and try to perform the surgery on your own. Please don't do that. I think that's a really bad idea. And with EMDR, when I explain it, it might seem so doable, but with EMDR, it can be like opening Pandora's box. You don't know what's stored in your unconscious. You don't know what's going to come forward. And you need a therapist to help you contain whatever is coming up, bring the session to a close so that you can calm down and you can go on with your life. That you're not having panic attacks and anxiety because something came up you had no idea existed. And you also need a therapist to help you get back into the present, complete the experience. And that's just something that if you're not trained, you won't be able to do. So if you do the protocol the way I explain it, you might be stuck somewhere and then what do? You might feel horrible, and I don't want that for you to happen. And really, please take me seriously. It can be unsafe. So if you're going to do an EMDR session with your EMDR therapist, you're not going to just dive in. I sometimes get that from clients. Let's do EMDR today. Oh, there's a little bit more to it. We first start with prepping. We start with what's called a case conceptualization. So the therapist identifies the presenting problem. So why are you here? What is bringing you into therapy? What's bothering you? And what do you want to be different? And so then the therapist takes a history of events that caused the presenting problem. So let's say it was anxiety. And the therapist and you in collaboration collect a history of the present, the past, and also future worries. Things that caused anxiety or bring up anxiety. Or the therapist helps you write feelings back in time. So like, when was another time you felt anxious? What was going on there? And what were other scary events? And so then you create the case conceptualization, like a treatment plan. And then you also identify what we call the negative core belief. And that's like an umbrella belief. Again, if there's a scary thing that happens, it's like there's a file created in the brain, and all scary events that are very similar, they go into that file. And it's labeled. And we're looking for that label. What does that mean for you? What does it say about you? We call that the negative core belief. So the label of that file, let's say you're dealing with anxiety, I'm unsafe. And the therapist collects all of these memories, puts them in order. And as an example, I give you one really quick. I had just made another video about that. I was using my own EMDR process. I was run over by a person in a parking lot. It triggered me. It caused panic attacks. Then I was collecting events, writing that feeling back in time. It reminded me that I was strangled in public at some point. I was attacked by gang members. And to summarize what these events say about me, for me it was, I'm unsafe. So the therapist will help you identify the negative core belief. And next, you identify the positive core belief. What would you rather believe about yourself? And it can be a little bit tricky in the beginning. So if I'm looking at I'm unsafe, I don't know, I want to believe like, well, I'm safe, but we need to find something that the unconscious is willing to accept. Also, that's true. So I'm safe, you could say, I'm safe now. Or in my case, I learned how to keep myself safe, or I can keep myself safe. And the positive cognition, the positive core belief, it can also change while you're processing. As you're going through experiences, you might come up with even better reframes or different reframes. That's fine. But when you're conceptualizing with your therapist, most likely you're just going to do a layout of the land, what area you want to improve. And what you're going to do with your therapist next is called resourcing. So the therapist is going to teach you EMDR stabilization and grounding skills. I have a video on that. It's how to stop a panic attack. These are, to my knowledge, all of the skills I teach in EMDR preparation. So you can calm down, you can stabilize, go from upset to calm, or ground yourself if you feel a little bit woozy or not quite present. So you're learning the EMDR stabilization skills. You would most likely also learn affect management if that's necessary. Affect management means that, you learn to stay present when you're dealing with scary memories. So that you can go from upset to, okay, I'm going to calm down. I'm okay. I can deal with this. So, we call that affect management, to put it very basically. And then, with affect management, you might also learn to maintain dual attention, because when we're doing EMDR, we need to be present. So client and therapist are present with each other. So you need to have one foot in the past, bringing back the memory vividly and going through the emotions and the emotional arousal, the distress. But you also need to have one foot in the present, so you don't lose yourself in the past and get overwhelmed and fall apart. You also need to be able to be in the present. And these are things that need to be learned and prepared so that you can fully participate in EMDR and that it's safe. Another thing that happens with resourcing is that the positive belief that you identified, the positive core belief or cognition, positive cognition, that's strengthened. Sometimes we do that with eye movements or tapping or stomping or bilateral sounds, right ear, left ear, and just to remind ourselves of the many examples that support the positive belief, is most likely that's there. our brain is funny that way. It remembers the worst and forgets about the good pretty easily, because the bad experiences, they're more helpful for survival. They help you avoid future dangers. And there are plenty of examples for your positive belief, but they don't come into awareness as readily, because they don't have a purpose for survival, unless we harness the power of the brain with EMDR. So part of resourcing is also strengthening the positive belief or cognition. And then resourcing also can include a little demo by a therapist, just so you get an idea of how EMDR works. If it still seems a little bit scary, I actually often do that with clients. Just picking some event that's just mildly upsetting, just to see how it works. And then usually my clients are excited to get started. And then in the standard protocol, if it's not a very, very, very complex case, we go to access and to activate. So we go into processing. We have our treatment plan laid out, events in the present, past, maybe even future worries. We know what the overarching umbrella negative belief is. We know what we would prefer to believe or know to be true. And we have all the resources to deal with emotional states and calm down. And we're starting to process. And then we pick one memory. We're choosing the first event. And that can either be, we can work from present triggers to the past, or from the past to the present. Another thing we can do is just to start with the most relevant event, which is what I did in my therapy, in my last therapy, that I got run over, I got scared. Let's start there. It will just go back to past events. That's also an approach. So, and I'm going to use my examples to make the process more clear. So you choose the event. I chose being run over in a parking lot, and then you identify an image. So you think of the event and you let it run by your mind like a movie. And if you had to stop the movie at the worst part, what's the image you're seeing? Or you focus on the worst part and use that. In my case, that was just being hit in public. It was an image, being hit in public. And then again, we bring up the negative cognition. For me, that was I'm unsafe. We identify, double check the positive cognition. In my case, I know how to keep myself safe. And then we rate, we call it the VOC, the validity of cognition. We ask, so the positive cognition, when you think of the triggering event, the bad thing that happened, how true is the positive belief right now that you would like to believe instead? How true is that on a scale from 0 to 7? And it helps us measure if it's totally not true. I'm unsafe. What are you talking about? It's a 0. Well, maybe I'm a little bit safe, but I don't really feel that way, so maybe it's a 1. And 7 is like, I feel totally safe. I feel equipped to deal with whatever comes my way. I got the tools. So in preparation to start processing the one memory, we rate the validity of the positive cognition. Then we think back on the incident, the scary thing that happened, and identify the emotions. What emotions are you feeling if you think of the bad thing that happened to you? So for me, it was being run over in the parking lot, but being hit in public, the emotions that are coming up. We was, scared, vulnerable, helpless, powerless. yeah, probably some others I can't think of right now, but the emotions associated to the scary event you want to process. And then you rate the SUD. The SUD is subjective unit of disturbance. What that really means is how bad or how distressing or how upsetting is thinking of this scary event right now on a scale from 0 to 10. 0 is just like, well, actually, it's not scary at all. 10 is probably so overwhelming that maybe you can barely contain it. 9 is pretty upsetting, but I can keep myself together and I can stay present. So wherever it is, because then we also have a sense of, well, how much work do we need to do until it's a 0 or maybe a 1, so that it's not really upsetting anymore or distressing or just bad, whatever works best for you. And then when you know how upsetting it is, and then you think of back on the event that you wanted, the scary thing that happened that you want to process, the negative belief, the emotions that are coming up. What do you feel in the body? What do you feel the emotions in the body? Tension in the chest, in the shoulders very often. Sometimes it's in the diaphragm, but most likely you're going to feel the sensations, the upsetting feelings, you're going to feel them in the body. And what comes next? So you laid that out. What comes next is you focus on the image, so the incident. You bring back the negative belief, I'm unsafe. You notice the feelings, you notice your body sensations. You hold all of that in mind, and then you follow the eye movements. And I literally just do it like that on camera. I say follow my fingers, and you do eye movements. I'm going to show you, it's going to look goofy, but from the left to the right, you follow eye movements, holding all these awarenesses in mind until the therapist says, let's stop here, take a breath. What do you notice? And then you just bring up whatever comes to mind. And it can be a memory, or maybe more details of the memory, or other images, sounds, feelings, more physical sensations, anything that is coming to mind in the standard protocol. Anything that's coming to mind, and you just say that. And here I have to add, EMDR is not talk therapy. So we don't talk about it for a long time. You just briefly describe what's coming up for you. The therapist doesn't need to understand it. And you also don't need to talk about all the details, which is great if you're processing something like a rape. Why not want to talk about all the details? You don't have to. It's happening in your head. You just kind of report what's coming up for you, and the therapist says, okay, let's go with that. The pictures, more eye movements. Eye gaze, back and forth and back and forth. The therapist again goes through the passes. Okay, stop here, take a breath. What do you notice now? And so it goes from one thing to the next thing to the next thing. And it's amazing the ease by which it happens. Because if we sit there in therapy and we try to talk about it, it's like, for me, it scrambles my brain, and it seems too exhausting to think about it and figure everything out. But the brain, because events they're neurologically linked, it will go from one thing to another. And you just report what you're observing. There are exceptions, such as an attached-based EMDR, where you might work in different ways with the therapist, or also exceptions when the client gets flooded, too much emotion, can't handle it, or overwhelmed, or stuck, or draws a mental blank. Then the therapist would slow down or break the incident into small chunks that are not overwhelming, or do more positive resourcing, strengthening the positive belief until the client can handle more exposure to the scary event. But these are for more complex cases. So if we do the standard protocol and we're not running into issues, we just keep doing that. We do the eye movements. You can also do tapping. Some people prefer bilateral tapping. You can also wear headphones, have bilateral sounds where the sound goes off in the right ear, the left ear, right ear, left ear. Or some therapists, when they do virtual EMDR, they use a program where a dot is just moving back and forth. I prefer the old-fashioned way of just following my fingers and seeing the client and maintaining rapport. But I hear all kinds of things, and different things work for different people. But the amazing thing with this processing is that the brain is wired to move from the negative to the positive. Our brain is literally made to process scary events and come to a positive resolution. We call that the adaptive processing model. So if we do that, and even if we go into scary events, we move through very quickly, and the brain wants to go into the positive. It also, we're also starting to access, other memories that actually, we survived it, we handled it, we have a lot of resources now, but it goes into the positive. And when that happens, the therapist disrupts the eye movements and checks on the SUD, so the subjective units of disturbance. And the therapist asks, so how bad is it now? Or how distressing is it now on a scale from 0 to 10? When it's a 0 or very low, then we move into the installation phase, where we're dealing with a positive belief. Again, that's a standard protocol. Sometimes we don't go in one session from a 0 to 1. Sometimes maybe we get to a 5 and we have to come back next time. But if the upset has gone down, we're going into the installation phase. And then you think again about the disturbing event. You think of the positive cognition. So I would think of being run over in the parking lot, and I would bring back my positive cognition of, I learned how to keep myself safe. I know how to keep myself safe. And then the therapist is going to ask, so how true is that? On a scale from 0 to 7. That's the VOC, the validity of the cognition. How true is it? Is it a 0? It's totally not true. Or is it a 7? It's absolutely true. And then we are going to do more sets. So think of the event. Bring the positive cognition to mind, and follow the therapist's fingers. Continue eye movements. Those are going to be most likely slower sets, and also shorter passes, they're called, or sets. It's going to be slower and less eye movements. And then the therapist is going to ask you, how is it now? Has it changed? Has it improved? And you do more until Let's say the validity of cognition is a 7. So it means my new positive belief is absolutely true. And when that happens, then we move into the body scan. So then you think again of the disturbing event and you think of your positive belief and you notice how it feels in the body. Is it clear? Is it neutral? Or is there still tension, discomfort? And if that's the case, think of the incident, focus on the new positive cognition, the new positive belief, and focus on the physical sensation, maybe tension in the chest. Therapist moves out of the way, follow my fingers, doing eye movements until the client reports like, no, body is neutral. Again, sometimes we can't do that in one session, but sometimes we can. And that's a complete session. Then we go into closing. So we might put the memory into the container. So maybe we weren't able to bring the upsetting memory to a 0 or 1. No, maybe it's a 5. So we need to come back and do more work on it. Or maybe another upsetting memory surfaced that you weren't aware of. Or there's some discomfort left, or even physical sensation. If there's something that lets you know you're not at peace, we put it into the container. And that's learned with the stabilization skills with EMDR. A container is imaginary or physical container that's intentional compartmentalization. So you put whatever upsetting thing, put it in a container. Mine is a movie trailer that's next to Griffith Park in Hollywood Hills below the Hollywood sign, because I had a view of the Hollywood sign for a long time and it's nice and warm there and I felt safe there walking on these trails. But whatever, it can also be a box. Sometimes people write little notes and stick it in a box and push it under the bed, knowing that, okay, there's something that's upsetting. I don't need to deal with it right now. I will get back to it when I can. But I'm going to put it in the container and it can wait there for later. And when I have time, I'm ready, then I'll bring it back up. And we'll bring it back up in therapy. Another closing stabilization skill a therapist might do with you is going to the sanctuary or a peaceful place. And that can be a place that you remember where you felt perfectly safe, or an imaginary place, or you can have a few places. An imaginary place where you can sit and feel perfectly safe. And just sit there. Maybe close your eyes, just sit there and engage in breathing techniques, which you also learned to calm down, bring down nervous system arousal. Or sometimes we also do positive resourcing to ground and calm down the client. So things we learned, maybe working with a positive belief, or other ideas we came up just to calm down, support the positive belief, bring the client back into the present. The present is safe, otherwise we wouldn't be doing this. We'd be running or hiding somewhere. And that in closing, then you would most likely integrate insights with your therapist. So then you talk about what was learned, how the experience was for you, how you're feeling now. And the therapist is going to make sure that you don't leave the session in upset or frazzled or ungrounded, that you're feeling good. And that you know what you learned from it and what you're taking with you from the session. And before I end this video, I just want to briefly get into the idea EMDR didn't work for me. So I hear that and I feel so sad. when I hear that, because I know how amazing it can be. But EMDR is difficult to learn for a therapist. And even, sometimes we learn by trial and error, and then we run for a consultation with a very experienced EMDR consultant, or we take more continuing education, which we have to do anyway. But sometimes, I hear EMDR didn't work for me. And so one thing you can do, if you had that experience and you are hesitant to do EMDR again, you can talk to your therapist and let them know, this did not work for me. I felt horrible afterwards, and can we adjust this? It's not working. And so if the therapist, let's say if they're rigid, or they push it on you and say, well, are you not ready, or maybe you're resistant, whatever it is. I've heard all kinds of things. Then it could be a good idea to look for maybe a more experienced EMDR therapist, or for somebody who is EMDR certified. That's somebody who went for a full certification, has a membership, and is taking ongoing continuing education and consultation. So that's somebody who has a greater commitment to EMDR, and they most likely have more skills. At least that's the goal, but they have more skills. And you can look that up at emdria.org, the organization that governs EMDR therapy, and they have listings for therapists. Another thing that could have happened if you had a bad experience with EMDR is that there was not enough resourcing. So when the brain doesn't go into the positive resolution, and then it might be necessary to learn more coping skills, or spend more time strengthening the positive belief. If a client gets stuck and it seems horrible, and the client is just feeling horrible, and we don't go into the positive. So maybe you would have needed more resourcing. That can be done. And then if we have the negative here and we have the positive that's usually not as strong, we can increase the positive so it can override the negative more easily, or connect but neutralize the negative. So maybe that wasn't done enough. Maybe more of that needs to be done, or more resourcing that fits your personal needs. Another mistake that can happen when someone says EMDR didn't work for me is a pacing mistake, that it was too fast. Again, that there wasn't enough preparation, there wasn't enough resourcing, or that the events are too scary, too disturbing, that the emotional reaction when even thinking of them is just too strong. And then the therapist needs to break down the scary event into tiny little fragments, or I like to call them bite-sized chunks, that you just deal with only a tiny little bit, and then next session a tiny little bit, just slower, so it doesn't become overwhelming, and leaves you flooded, overwhelmed, maybe dissociated or slightly dissociated, or just plain old feeling miserable afterwards. You shouldn't be leaving sessions feeling miserable or upset with good resourcing. Another thing that can happen if you think EMDR didn't work for me, that with the therapist, that the processing had exceeded the window of tolerance. So we have a window of tolerance, how much emotion we can hold before we fall apart or shut down. And sometimes we need to learn to extend this window of tolerance. We need to learn to tolerate more negative emotion. Yes, we can learn that before we have a meltdown or a shutdown or get so freaked out that we can't function anymore. So maybe the window of tolerance first slowly needs to be increased so that you can comfortably work on the scary events. Let's see. Oh, and another thing I wrote down, so if you felt horrible after a session, it's possible that there was not enough closure and stabilization. and that can happen if you're locked into a 53-minute session. You're going through insurance, or the therapist works back to back. But really, I think it should not happen. Then again, ask the therapist to adjust. And hopefully the therapist knows. I think well-trained therapists know not to release someone out of the session if they're feeling horrible or they're still in upset. To continue stabilization exercises, grounding exercises, positive resolutions, positive resourcing, breathing techniques, whatever is needed until the client feels good. We still put things in the container. But if you feel horrible after a session, I think there wasn't enough work on closing the session. I hope this was helpful to you. If you have questions, please post them underneath the video. I love to explain EMDR, and I don't get tired talking about it, and I would love to answer your questions. And I hope that as you're hearing this, that going into an EMDR session feels less scary, feels more predictable. I'll see if I find a friend who will do this with me to just demonstrate the process. I will post a video like that, but I always have to respect client privacy. And if you enjoyed this video, I appreciate it if you subscribe. Hit the notification button if you want to see future videos. And again, please leave me comments. And before you leave, know that you're precious. Know that you matter. Know that you're valuable. And your life matters. And your well-being matters. And if you're not feeling good, there's no reason to think that this is just how it is. It doesn't have to be that. You have so many resources available, even wired into your brain, to get better, even faster than you might expect. And so please don't settle for unhappiness. Get help. Get help. Take some time to update negative beliefs, events that were hard for you, and move to a place where you can enjoy your life, be exuberant, and experience joy and good relationships. Please take care of yourself. I'll see you next time.